Am I safe? Let's talk about it. I was going to make a different video, but a lot of people have been asking me about what they should be doing and what they should be wearing for for COVID-19. So let's talk about. There's a couple of things we should talk about. One is isolation precautions. What are they? What do they entail? Which one is Corona? There's a few types of isolation precautions. The first, most basic, easiest to deal with is fluid precautions. If there's a bodily fluid that carries contagion, this is blood, urine, stool, sexual fluids. If that's the case, then the isolation is really simple. Wear gloves, don't touch the fluid. Dispose of any garments or materials that touch the fluid. That's one. Two, the one that you run into the most often in the hospital, contact precaution. Contact precaution is that there's an infection that spreads through a secretion or a fluid or a particle that can live on a surface for an amount of time and is usually living on the skin or clothing of a patient with the illness. To protect yourself from this, you would not come into direct physical contact with the patient, and if you do have to, you would wear a gown and gloves. Next step up from contact, droplet precautions. You've probably all been hearing this word a lot, droplet. In a droplet isolation precaution procedure is thus: you wear a gown, gloves, and a surgical mask. If you don't have that PPE, or you don't have to make direct contact with the patient, you should be 3 feet away from the patient or the person with the illness. What is a droplet isolation? A droplet is a small particle, but in the scale we're talking about relatively large particle. I know, small and large. And it is excreted from the body. This is most often from the respiratory system. When you're thinking about breathing, talking, coughing. You're not really thinking about sneezing. Sneezing is something else. I'll cover that. Talk about that in a minute. Talking, breathing, coughing. This makes droplets. These droplets can travel through the air a short distance. Again, talking about 3 feet. I'll tell you why you're hearing 6 in a minute. 3 feet. The droplets can live on surfaces, not always, but in this case, I guess it can. So, which is why I'll get to it in a second. So, why surgical masks? Surgical masks are made and rated and designed specifically to protect people from droplet precautions. So, okay. Why gloves? It's obvious. You should always be wearing gloves. Why a gown? Droplets can gather on your clothing. You don't want to have it with you. Wear a gown. Dispose of the gown. Next one up from there, we have airborne, the big one. Airborne. If there is an airborne precaution, that is because there is a contagion that can live on very tiny particles, very, very tiny particles that get aerosolized. Because they're so tiny, they don't drop ever, really, maybe eventually, but not helpfully, in air because they have very low density when compared to the air, which means they stay afloat and they tend to spread out. So where should you stand? 6 feet away, 6 feet. What should you be wearing? An N95 mask. What else should you be wearing? Goggles. Eye protection, because your eyes are what's called a mucous membrane. This is a semi-permeable barrier that protects your soft organs, but is susceptible to liquids and small particles that can go right through. You should be wearing gloves. You should be wearing a gown. Okay, that's the 4 types of isolation precautions. So, what is Corona? I want to specify that the date today is the 29th. This is the 29th of April. Anything I'm saying now might be wrong in the future, but it is correct right now. According to the CDC, corona is, in general, a droplet precaution, which means that people should be staying 3 feet away from each other. They should be wearing surgical masks that cover their mouth and nose. And they should be, if you're going to be dealing in close, intimate proximity with someone who you think might have the virus, gloves and a gown. It's also a contact precaution. Why is it a contact precaution? It's a contact precaution because the virus can live for an amount of time greater than a few seconds. We're talking hours on surfaces. Both, we're talking about a few hours on porous materials and many hours on non-porous materials. That makes it a contact precaution. So if you're going to be around anywhere where you think there might be people who have the virus and you're going to be touching things, any things really, anything that is a thing, wear gloves or carry hand sanitizer and clean your hands often and regularly. So why do people say to stay 6 feet away? Why are people wearing N95 masks? What's the deal? When you walk into a hospital, how come all the nurses and medical professionals are wearing big masks or double masks and eye gear and all of that? When you're talking about a pandemic and you're coming up with procedures, what you're talking about is risk management. A normal person going to a store, going on the bus, walking through the street, isn't around an amount of people likely to have coronavirus, which warrants them wearing N95 masks. Whereas if you're a medical professional and you're in and out of hospitals, you're going to be around all sorts of people. So let's talk about, but if it's a droplet, why does anyone need the N95 mask? There are certain procedures which cause what's called an aerosolizing procedure. This is CPR. This is intubation. That's what you see in the TV shows where they put the tube down the throat. This is a nebulizer. If you have asthma and you have to use a nebulizer, that will cause an aerosol. If you, let's see what else. There's obviously use of a respirator. All sorts of things can cause aerosols. Actual symptom. Crazy that it doesn't, but it doesn't. Which means that the normal person isn't likely to run into a COVID positive person who creates an aerosol. But in a hospital setting, you have tons of people of different levels of health going through all sorts of things, and an aerosolizing procedure might be done. And in that case, these little tiny particles can stay in the air for a long time. So it's important that the medical professionals wear the proper PPE. Even separate from that, we run into so many people on a daily basis that the chances that one of them will have COVID-19 and also allergies and might sneeze is greater. So that's why in that sort of setting, in an actual hospital, in an actual doctor's office, it's treated like an airborne illness, even though it isn't. Now that's according to the CDC, and that's of the 29th of April. I know there are other countries that are officially declaring that it is airborne. We'll see who's right in the end. But that's right now. So why am I making this video? Besides the fact that people have been calling me and getting a little stressed. Well, I want to discuss exactly some of the implications of what I just said. A lot of very smart people have been saying things like, hey, tie a bandana around your head. It's just as good as a mask. Because unless you have the very best masks, it's not going to protect you from COVID-19. And this is all just about preventing your sneezes from getting out. It's not true. It's not true. Again, as I just said, a surgical mask is specifically designed to stop the person wearing the mask from being exposed to droplets in the air. So wearing an actual surgical mask is better than wearing a bandana. What was the other thing wrong with that sentence? It's there to protect you from the other people from your sneezes. That's not true. A surgical mask will not protect other people from your sneezes. It's not meant to stop aerosolized particles. It's not there to stop airborne particles. So a bandito mask, other people if you're sneezing. If you are not sneezing and you are wearing a mask, that is the best thing. That is so much better than me wearing a mask and you having COVID or just breathing into the air. I would rather have sight control. But if you are sneezing, it's not going to protect other people from your. I'm a big one for PPE. If you talk to anyone who works with me, they will tell you that I wear a ton of PPE. I always have the goggles. I always have my N95. If I have a positive patient, I'm wearing another N95, no, another surgical mask over it. I'm wearing the gown. I'm wearing the gloves, and the gown is tucked into the gloves. Probably wearing my jacket. It's. I wear a ton, but people see that and they think, oh my God, I better not go outside. Go outside. I'll tell you what, go outside, see a friend from a few feet away. Maybe both of you wear masks, but don't isolate yourself so much that you're stressing out, you know? It's really not an airborne illness. If you're the proper distance away and you're wearing even just a normal or even just a homemade mask, don't feel like you can't go take that walk. Don't feel like you can't go to the park. You know, it's fine. It is. But I also see people, in stores wearing full painting respirators, gas mask. I saw a guy wearing a gas mask with the drums. I've seen so many people wearing N99s, N100s incorrectly, and just wasting these masks that I would love to have for myself. And that's also not necessary. There are two sides, and they're both wrong, and you should be right in the middle, like most things. Everything in moderation. So that's this video. I hope. Oh, real quick. So why are we being told to stay 6 feet away? It's a fence around the rule, people. It's what it is. People don't stick 6 feet away from each other, and if people were told to stay 3 feet away from each other, they wouldn't stand 3 feet away from each other. But if you tell them to stand 6 feet away from each other, they might stand 3 feet away from each other, and they should. Please stand 3 feet away from each other. Don't crowd. Don't group up. But that's what that's about. I hope that this has been enlightening. I hope that it maybe has helped de-stress some of you. I wish I had shaved, and have a good night.